Good morning, everybody. Let's talk briefly about eczema. This is the time of year, winter time, that we see lots of eczema. Eczema is a fancy word for more intense dry skin, also known as atopic dermatitis in the world of dermatology. It can range from just feeling like dry skin to red and dry to red, dry, and cracked. In babies, infants, this is really common. Very common on the face, the cheeks, okay? And very common on the areas where the body moves. So our joints where it flexes. So wrists, ankles, our elbow area, and our knees. The reason we see it more in winter time is it's drier out. We turn our heaters on inside and it sucks the moisture out of the room. And obviously moisture for our skin is a must. So those of us who are more susceptible to eczema or dry skin get a little bit more itchy and dry during the winter. That includes your scalp. That's why you may be a little bit more itchy in your scalp too. So for our babies, we see a lot more eczema this time of year. And this old wives' tale that you should not be bathing your baby every day is actually false. Bathing is like awesome for dry skin, as long as we're not doing super hot showers. If you're like me and you love super hot showers, probably not the best for your skin. But we're not doing that for our babies. We're not putting them in hot water. So lukewarm to warm baths, great for the skin. The skin is absorbing that water and that water is bringing moisture. So great time to get moisture back into the skin. And we want to stay away from scenty soap, okay? So don't do the lavender baby, shampoos and stuff like that. We want to use sensitive baby soaps, okay? So I know Aquaphor makes one, Dove makes one. So anything that's sensitive skin and moisturizing. I tend to lean towards Dove, but I like Aquaphor too. Cetaphil, CeraVe, they all make their own now, and they're all sensitive skin type of soap, okay? Obviously, if you have a newborn or an infant, we're not going to wash their face or hair with a soap that might get in their eyes and burn. So you can, use your baby shampoo up there. After bath time, and if you have a older kid, after bath time, we're going to cover the body in what we call an emollient, which is just a fancy word for a really thick, good moisturizer. And again, we have a lot of names we could use, okay? Anything from a greasy version of Aquaphor ointment to CeraVe cream, Cetaphil cream, Vanny cream, okay? But if you're hearing me repeat the word cream, it's a reason. We're not doing lotion. Lotion is too thin, okay? We want cream. We want it to be in the jar. We don't want it to be in the pump, okay? Jar of stuff, okay? Or Aquaphor can come in that squeeze thing. But I like jar because you're more likely to use the appropriate amount and dig your fingers in there and put it on, okay? And we want you to like grease up your baby or your kid, okay? And put it all over. Now, if your child is in a flare means that the skin is red or cracking, then we need you to use some topical steroid. Hopefully, if you've gotten to this point, you've already talked to your doctor and they've prescribed a topical steroid. Now, you might have a flare in one spot. You've used the topical steroid, it goes away, but then another spot pops up. So if you're having to use steroid on different parts of the body and it feels like every day you're using it, that's okay because you're not using it on the same spot over and over and over again. You might have to use it 2 days here and then 2 days here and then maybe here and then maybe on the cheek. It's okay to use it that way, okay? As long as in between we are using moisturizer everywhere, okay? So you'll use triamcinolone ointment for 2 days, maybe if the wrist is really, really red, and then that gets better, but then you get a spot on the cheek and you have to use it for a couple days there. Eczema does this. It gets better, it gets worse, it gets better, it gets worse. Our emollient, our cream is meant to try to decrease the amount of times we get breakthroughs, but it's not perfect. Like this weekend, we had really intense cold weekend, and I'm sure a lot of people's eczema was like really flared this weekend. And that's just the way it goes. And during those really, really cold spells, we're going to have more eczema flares. And that's why we have our breakthrough steroid cream. Now, for our more intense eczema patients, we have an even more we have another secondary medication that we can use if they're a little bit older. We have Eucrisa, we have Protopic. Protopic's got a generic version out. And then we have even more as the patient gets older and it's still persistent. If you're having to do these things called wet, dry wraps, you may even have to qualify for what we call injectable medications. Now, at this point, you're seeing dermatology and you've surpassed pediatrics. And if you're having constant cracking and breaking of the skin, that increases your risk of bacterial infection, which is what we don't want to happen. In that case, we're putting, wraps on the skin to try to keep the skin moist. We're trying to keep critters out, meaning bacteria. And we're getting dermatology involved, because the beginning of eczema, we're doing emollients and steroid cream. That's something that pediatricians can take care of. I do it all the time. But when we're getting into biologics, certainly that's when we get dermatology involved. And that typically is as we get into the older years and the atopic dermatitis hasn't gotten any better. Now, this talk is not meant to talk about underlying causes such as, is there food allergy? What about the allergens in the air, etc. When they're babies, this is not something I look deep diving into, especially because babies so commonly have eczema. But when eczema becomes persistent or is severe, and I don't mean you just get a little bit in your cheeks, I mean when it's severe and we're having trouble managing it, that's when I start to kind of deep dive into, do we have a dairy problem? Do we have, a food allergy problem? That's when I start to look at it. Is there another reason we're having trouble with our eczema management? So just to give you a little bit of discussion on that, I don't want to have a 20-minute talk. So I hope this helps kind of guide you, especially about the bathing, the emollient, and the steroid. Do not be afraid of the steroid. It's necessary, okay?